Assalamualaikum and hello everyone. So today we would like to talk about the study case of biology topic 2. So my name is Siti Nurasha binti Muhammad Zani and my student ID is 2020478978 and I am from class AS1202 class 5 and I am from UiTM Tapah Perak. So today I have 4 contents is introduction, case study question, summary and reference. So let's talk about the introduction. The introduction I will tell today is about the enzyme and also chronic meningeal leukemia, or also known as CML. So the enzyme is a substance that acts as a catalyst in living organism, regulating the rate at which chemical reaction process without itself being altered in the process. That is a definition of the enzyme, and for the CML or chronic meningeal leukemia, also known as chronic myeloid leukemia, it is cancer of a white blood cell. So today's case study is based on the story of Mike Callahan, a patient afflicted with chronic meningeal leukemia, CML. CML is caused by a chromosome mutation that affects the tyrosine kinase (ADL), an enzyme important in regulating cell growth and proliferation. CML is a genetic disorder of bone marrow in the stem cell which proliferating of mature glutinous such as neutrophil, eosinophil and basophil. Okay, so now we jump into the case study. So for the first question is define the catalyst and describe the role of enzyme in biological system. So the catalyst means speed up chemical reaction but stay unchanged at the end of the reaction. So we see the role of enzyme. So enzyme is the metabolism control at some point called catalyst, important action in life, serious at chemical process. This process regulated by enzyme. Same reaction can occur without enzyme, occur at a much slower rate, and the enzyme remain unaltered. So the enzyme can be used again and again. So for the next question which is question 2. Classify type of enzyme inhibitor which you have learned in class. So what I learned in class, we have 2 types, which is reversible and irreversible. So for reversible, we have non-covalent binding, bind loosely, temporary change the conformation of the active site of the enzyme, and active site can function again because it was reversible, right? So we can use more and more again. So for the example is non-aspiric painkillers such as ibuprofen and also flurbiprotein. And for the irreversible, we have a covalent binding, bind extremely tight, permanent change the conformation of the active sites of the enzyme. Active sites cannot function at all after we have been used. And irreversible enzyme inhibitor are toxic substance. Next, for the question number 3, the question is all about to elaborate more on the cause, symptoms and diagnosis for patient Mike Callahan. So, for the cause, an abnormal chromosome developed. It is because the human cell normally contains 23 pairs of chromosomes. This chromosome hold the DNA that contains the instruction or gene that control the cell in your body. In people with chronic meningeal leukemia, CML, the chromosome in the both cells swap section with each other. A section of chromosome 9 switch place with the section of chromosome 22. So creating an extra short chromosome 22 and an extra long chromosome 9. So the extra short chromosome 22 is called the Philadelphia chromosome, named for the city where it was discovered. The Philadelphia chromosome is present in the blood cell of 90% of people with chronic meningeal leukemia. So there are a risk factor that increase the risk of CML, such as old age, being male, and radiation exposed such as radiation therapy for certain type of cancer. So the symptom that we detect during the blood test, such as the foot pain, easy bleeding, feeling easily tired, and weight loss. So we diagnose by complete medical, which is a clinical examination, and complete blood count, and also using a bone marrow test. Okay, so now we are in the question of number 4 for this case study. So the question is, how the treatment by food and drug administration using tyrosine kinase inhibitor can help mild. So my answer is, we can use by imatinib. Imatinib is a type of cancer growth blocker called a tyrosine kinase inhibitor, TKI. Tyrosine kinase are protein that cells use to signal to each other to grow. They act as chemical messenger. This is the first thing when we have a CML. This is the first place that we can do. So the next we have a dasatinib. Dasatinib. So dasatinib is a class of medication called kinase inhibitor. It works by blocking the action of an abnormal protein that signal cancer cell to multiply. This helps stop the spread of cancer cell. So for the next things that we can do is, we have nilotinib. Nilotinib also a kinase inhibitor used for the chronic phase treatment of CML. That is peripheral chromosome positive. And for the treatment of CML is the resistant therapy contempt imatinib. So next we have also the bosutinib. Bosutinib is a class medication called kinase inhibitor. So it works by blocking the action of an abnormal protein that signal cancer cell to multiply. So it stops the cell to multiply to help them not grow more. So lastly, I have a ponatinib. Ponatinib is a novel BCR ABL tyrosine kinase inhibitor that is especially effective against the T3151 mutation for the treatment of chronic leukemia. Okay, finally we are at the last question, which is the question number 5. So the question number 5 says, is there any other relevant option for treatment? Yes, we have it. So my answer is, we use the omacitacinet. Omacitacinet is a generic name for the treatment chemotherapy drug Shinribo. In some cases, healthcare professionals may use the treatment Shinribo when referring to the generic drug named omacitacinet. So the second option is use the allogenic stem cell transplantation. This involves transferring the stem cell from the healthy person, the donor, to the patient body after high intensity chemotherapy or radiation. The donated stem cell can come from the either related or unrelated donor based on the some situation. See, we have the conclusion is the summary for today and also the reference. For the conclusion, I think enzymes are essential for healthy digestion and healthy body. They work with other chemicals in the body, such as stomach acid and bile, to help break down food into molecules for a wide range of bodily function. So without the enzyme, we can live like a normal person. So that's all for me, and this is my reference. So I hope I have do anything wrong or speak something wrong. I hope you guys can forgive me. So see ya in the next video. Stay safe and please wear your mask. Bye.